7 Ovarian cancer symptoms every woman should know. Ovarian cancer symptoms are important because ovarian cancer is a chronic disease of the female reproductive organ. And, due to its quiet development, it is also known as the silent killer. It may be the second most common type of gynecological cancer, but it has a higher death rate because serious symptoms don't show in the initial stages of the cancer. The irregular growth of this organ cells results in ovarian cancer. It leads to malignant tumors that can spread to other parts of the body. While the exact cause of ovarian cancer is unknown, there is a greater risk for those with ovarian cancer in their family history, abrupt hormonal changes and unhealthy life habits. Medical checkups are necessary to detect cancers, but there are several signs that can help warn us of their presence, helping us get a proper diagnosis. We want to share the 7 main symptoms in detail so you can be alert if you have them. Keep on reading. 1. Abdominal distension. Abdominal distension is one of the first ovarian cancer symptoms. Despite being a primary symptom, it's one of the most ignored ovarian cancer symptoms because it frequently appears in cases of digestion problems as well as in those of premenstrual syndrome. You should seek a medical examination in order to confirm the cause of the ovarian cancer symptoms, especially if they occur frequently. Excessive growth of cancerous cells produce various inflammatory reactions in the body, and among the possible zones is the abdominal region. Changes in your menstruation cycle. Analyzing changes in the menstruation cycle can also be very helpful for verifying anomalies in the ovaries. First of all, women should know what consists in a normal cycle for their body and from there, determine if there are any irregularities. If you start to notice many changes in your period, you should consult your gynecologist to try to find out what's causing them. Keep a menstruation calendar so you can accurately record the dates of cycles. Pelvic pain. It can be quite alarming to consider pelvic pains as a consequence of a cancer in the reproductive organ. However, it's never a bad idea to keep the possibility in mind, especially if it's paired with other irregular ovarian cancer symptoms. People who develop ovarian cancer frequently experience ongoing pelvic or abdominal pain for no apparent reason. It lasts for several weeks and the pain is almost always intermittent. Difficulties with digestion. Women who develop ovarian cancer also may start experiencing distension and sensations of pressure in their stomach area. The disease provokes complications with digestion which are often mistaken for digestive infections or conditions. It's important to see the doctor if you experience recurring cases of chronic constipation, indigestion and cramping, nausea and vomiting, changes in bowel movements. 5. Unquenchable thirst. Changes in ovarian cell activity usually are accompanied by loss of appetite and notable weight loss. The development of malignant cells negatively impacts digestive activity and, as a result, patients feel thirsty, even after ingesting small portions of food. This is very dangerous because in many cases, it leads to severe nutritional deficiencies and anemia. Pain during intercourse. As already mentioned in this article, ovarian cancer brings about inflammatory reactions in body tissue. Furthermore, the inflammation can lead to pain during sex. While it's true that there are many possible reasons for this symptom to occur, it's important to keep in mind that ovarian cancer is among them. The pain is ongoing during the act, and vaginal dryness often is an accompanying symptom. Sudden and uncontrollable urination when cancer forms in the reproductive organs. Sudden changes in urination habits are normal. In some cases, it may even involve uncontrollable urination. The inflammation that occurs in ovarian cancer weakens the muscles of the pelvic floor, which reduces the bladder's ability to retain urine. As a result, people who suffer the symptom constantly need to use the restroom. Trips may even be only minutes apart. When the cancer further develops, patients also might suffer cases of cystitis or urinary tract infections. Do you have any of these ovarian cancer symptoms? Remember that, while there may be signs of ovarian cancer, you'll need to analyze them with the help of a professional because they may result from other ordinary conditions. If you have any risk factors, or any other reason to be concerned, seek regular checkups as a preventative measure.